Hello, everybody. I am glad that everybody is here with us. This is another episode of a Lunch and Learn series that we are doing this calendar year, 2025. For those of you who don't know me, I am Dr. John Stracks. I am a physician here in the Chicago area and also by telehealth who focuses on the elimination of chronic pain and other symptoms using mind-body medicine methods. I'm here today with Erica Walker, who's a colleague of mine at Cormindy Health and who also specializes in mind-body medicine and has done so for a long time. So she is a psychotherapist and a pain coach who's certified in pain reprocessing therapy, which we call PRT, and also EMDR. She was previously the clinical director, intake coordinator, and clinical supervisor at the Pain Psychology Center in Los Angeles. And so as a result, she has interacted with literally thousands of clients over the course of her career who suffer from chronic pain and other chronic symptoms. And she has extensive experience treating those patients, and I would say is one of the more experienced PRT practitioners in the entire world. And so we are grateful to have access to her here at Cormindy and here today in this Lunch of Learn. And so we're going to talk about the concept of somatic tracking, which is a key component of PRT and something that's been particularly helpful for our clients as they work their way out of chronic pain. So Erica, thank you so much for joining us this afternoon here in Chicago, this morning here in Los Angeles. It's nice of you to be here.
Thank you. Thanks so much for having me. I'm excited about this. I love talking about somatic tracking.
Good, good, good. I'm glad. Before we get started with that, can you just, for a few minutes, talk about sort of how you found your way into this field?
Yeah, so I'll start from the beginning. So in undergrad, I double majored in pre-med and psychology, thinking that I was going to become an occupational therapist. I was very young for a 22-year-old when I graduated college, so I wasn't quite ready for grad school. I happened to just stumble into a massage program at a school called the Institute of Psychostructural Balancing. So literally mind-body balancing.
Mhm.
I wasn't really quite sure what that meant at the time. So it was shortly into my career as a massage therapist. I remember I had this client come in for a massage, and he was a young man, was getting married the next day, and he was really nervous. You could just see the nervousness on him. When I was touching his body, I could feel so much tension. And so, kind of intuitively, I just put my hand over his heart, and tears just started to rain down. And I was interested in this. What is this process that's happening? How is this mind body connection so powerful that even just through that touch, all of this emotion can rain down and have some freedom and some space? So skipping ahead, eventually went back to grad school, found my way to Pain Psychology Center, and then found my way to you. And you and I have been collaborating now with clients for several years.
Mhm.
And I think that we have a really great working model here and how to support clients in a collaborative, integrative way.
Absolutely, absolutely. And, you and I have talked a lot over the years about how gratifying it is to see people who have chronic symptoms and have them work their way out of those symptoms and out of pain. Um, what's most gratifying to you to be part of that process with people?
Well, I'm a pretty results oriented person. I'm
Mhm.
a very skills based therapist when it comes to using pain reprocessing. It is gratifying when people start to have that moment of, oh, I get this. This makes sense to me. That's always a really exciting moment for me. Like, yes.
Mhm.
And then continuing on, people who are committed to the process, we see patients get better, and it's exciting. I mean, you and I, every single time, you and I get excited. I'm texting you,
Yeah.
John, oh my gosh, this client's doing really well. I'm super excited about it. So it is incredibly gratifying for me, especially as a person who had suffered from really debilitating level migraine. I had debilitating level menstrual cramps. Basically, if I just start from my head and work my way all the way down, I've had a little bit of everything or a lot of bit of everything in my body, and it took me quite a while to realize that, oh, this is directly related to my nervous system being upregulated.
Yeah, absolutely. And so many of us, I think, who work in this field have had our own experiences. We're human beings, we have our own bodies. And so sometimes our life experiences will show up as physical symptoms. It's interesting that you said that about how often you text me and tell me how well somebody's doing. I should go back and look how many of those texts have little hearts on them because I'm so pleased to hear how well people are doing. We're here today. We're going to talk about somatic tracking and do a demonstration for everybody. Can you talk a little bit about what somatic tracking is and what it means to you?
Yes. So somatic tracking can be a very powerful tool for a lot of people. It involves exposure therapy and it involves mindfulness. So mindfulness, as defined by John Kabat-Zinn, is being present to the moment on purpose without judgment. Right?
Mhm.
So we're very judgmental when we have something that we're experiencing that we don't like. We want to try to force it to go away. It's very challenging for us to be present to a moment because we spend so much time thinking about what's happening in the future or lamenting about what's happened in the past. Right? So we want to take that mindfulness and use exposure with that. So exposure means that we're going to move toward the thing that makes us uncomfortable, right? We want to avoid things that make us uncomfortable. If we move towards it, then we're teaching the brain that this is actually a safe experience. Does that make sense?
Mhm, mhm. And so it's an important skill. And like I said, it's one of the core skills of PRT. And it's important skill because it what helps people be with those physical sensations without being scared of them. Is that a good way of putting it?
Yes, I would say that's a good way of putting it. And this can be easier for some folks. It can be challenging for some folks. If the level of fear of the body is so high, then starting off with really small increments of I'm just going to check in and notice what's happening in my body while I'm breathing and allowing myself to slow down.
Mhm,
With the demo, I'm going to be walking us through the entire process, and then I'm going to bullet point the steps that I went through.
Okay. Got it. And if I were a client of yours and we were getting ready to do this, say that I just started working with you, I had really bad back pain, how would you explain it to me to begin with? Like how would you set up the idea that we're going to do this, knowing that I have some hesitancy in paying attention to something that hurts that much?
Well, I might, I would invite you to participate if that's something that you wanted to do. Are you open to doing a little bit of somatic tracking? Can we try this? And I'm going to be with you the whole time. We're going to be communicating with one another.
Mhm.
And if there's ever anything that feels overwhelming, then we can switch gears and just let me know, and I'll be guiding this whole experience.
Mm-hmm. Got it. And so that's the advantage of having you there with people when they try to do this, especially at the beginning, is you can help them to move in and move out as needed.
Especially at the beginning, what we hear a lot is, am I doing this right? I've read about this technique. I don't know if I'm doing it right because I'm not seeing the shift that I was hoping to see, or I'm not, I just don't know exactly how to do this. So having someone guide you can be really useful in the beginning to overcome that fear of, I'm the one who's not getting it right.
Mm-hmm. Right. And we hear that a lot from people, right? People who are worried that they're not going to do it correctly, that other people are going to get it and they're not. And so one of the things that you do with people is slow it down enough so that anybody can enter into it.
Mhm, mhm. I think it also helps to sort of be able to follow someone's voice, right? Sort of quiet the chatter.
Mhm. Yeah. So let's try it out, if that's
All
okay.
right.
I'm going to give you the floor. I'm going to make you the main speaker here. And go ahead and I'll be listening so you can do it as if you're doing it with me, but everybody at home can try it out too, as well, just following your voice and following your prompts and see how it feels. Is that the
Mhm. Yeah, that sounds great.
okay?
So typically when I'm doing this with my clients, we're having a fair amount of interaction with one another. But I think today, because we have several people here, I'm just going to speak all the way through, and then we'll go into what the steps are. So you know this about me, but I will tell you, I'm going to close my eyes
Mhm.
because it helps me to go inside. You're welcome to close your eyes or keep them open. If you keep your eyes open, you will see that I use a lot of hand gestures. Okay? If closing your eyes is uncomfortable, it's okay to also just gaze down softly. I want to do this in a meditative style today. There are many ways to do somatic tracking. This is one way that people find to be very soothing. So I want us to start out noticing the sensation just of the breath itself. Noticing as the air comes in through the nose and travels down through the throat, you'll notice a rise and fall of the upper chest and expansion in the rib cage, softening in the upper and lower belly. And if it's helpful for you, you can put your hand on your belly and breathe into your hand. Get that soft expansion in the belly. We tend to hold a lot of tension here, noticing what it feels like as air drifts back out. Is it warm or cool or neutral? We're simply noticing these sensations while we're slowing the breath down and literally using the breath as a tool of communication back to the brain that we are perfectly safe here and now in this moment. This is how we want to breathe when we're in a rest and digest state. When we're in a fight or flight state, we want a more shallow breath so that we can oxygenate the bloodstream, that we can tense up the muscles in case we need to get out of a dangerous situation. But right now, we're in this nice, easy breath, creating an opportunity for the brain to bring the volume down on the nervous system. So just stay here as I'm continuing to speak. I like to imagine that off to the side, there's a little wicker basket over here. And in that basket, I'm going to put anything that's not serving me. So we're going to put judgment, fear, despair, negative fixation, anything that's not of service right now. We're just going to take a little break from it. It's not going away forever and ever. We're just going to keep it here in this basket. And then coming back to the breath, I like to set an intention. This is really important piece here. Let's set an intention of peacefulness. May I be peaceful with myself. Just for the next few moments, can I practice that? Can I take a little bit of space from everything that's over here in the basket and simply just be with what is right now? As you're ready, I want you to bring attention to a sensation that you're experiencing in your body. You might call this pain, this might be discomfort. I like to use the word sensation. It's a little bit more neutralizing. It doesn't have as much meaning to it. Simply taking a few moments here to notice a sensation that you're having. And you might imagine that you're watching it like waves coming into the shore. We're not intervening with it, we're not doing anything about it. We're simply peacefully watching the ebb and flow of the water. Again, we're teaching the brain this is a perfectly safe activity that we can notice a sensation without going into that monitoring that we sometimes do. So if you're experiencing a musculoskeletal sensation right now, notice what the quality is of that sensation. Notice if it ebbs and flows. Notice if it shifts to another location, which can sometimes happen. Is it louder? Is it quieter? What's happening there? Can we just notice it peacefully? We're not trying to make anything go away. Right? The trying to make something go away indicates that there's something bad, there's something wrong, there's a threat. This is the exposure part. Can I be with this without going into my typical level of reactivity? This might be challenging, and that's okay. It's okay to be challenged in this way. So now, what I want, and we've still got this nice, even, smooth breath here. I want you to bring attention down into your feet if your feet are a neutral place to be. If your feet are not a neutral place to be, maybe bring attention to your hands. You can rub your hands together. What we're going to do is we're going to create a different sensation. So if feet are okay, I want you to take your right heel, gently press in, lift your toes up off the floor, give them a little curl, and then relax the foot and set it back down. Left foot, heel down, toes up, give a little curl, and relax the foot back down. Now go side to side, so back to the right and then to the left. I want you to notice what the sensations are like on the top of your feet, that tendinous area, what it feels like when your toes curl, the bottom of the foot, the gravity of the pressing into the heel, activation in the ankle. You might even notice some sensation coming up the shin as you lift your toes. Again, I'm just going side to side, nice, smooth, even breath. We're simulating walking right now, just this gentle motion can stimulate a lot of different sensation in the lower leg and the ankle and the foot. Relax your feet. Let's check back in with the breath, noticing what it feels like as air drifts in and drifts back out. Once again, I want you to bring attention, pardon me, back to that original area of sensation that you were noticing. We're just mindfully being present to the sensation, creating an opportunity for the brain to bring the volume down. We're breathing in this nice rest and digest way. Just stay here for a few moments with that sensation. Notice if things try to come out of the basket. And set them back in just for a few more moments here. And breathe and notice what you notice. You don't need to problem solve it. Again, we're not trying to force anything here. We're coming towards instead of pushing away, instead of being demanding with ourselves. May I be peaceful with myself? And when you're ready, go ahead and open your eyes. And let's discuss. So, John, what was that experience like for you?
And it was actually really relaxing. And so I was actually paying attention to a spot around my chest. And it was actually really nice to both pay attention and pull my attention somewhere different. Because once I pulled my attention down to my feet, like there just wasn't any awareness. And it wasn't until I pulled my attention back up here that I noticed that that sensation was present. So it was actually really nice to get away from it.
Right. And I do that purposefully, right? Because we have a tendency when we have a sensation that we don't like, that can become the sole focus. We're forgetting about the rest of our body.
Mhm, mhm, mhm. Yeah. And so yeah, so I definitely noticed that. And I like sort of having the breaths that went with it because it just calmed me down. And so when I was paying attention to that sensation, there was a sense of calmness about it that's not always there.
Mm-hmm. Yeah. So the steps that we went through are I like to always establish a nice, smooth, even breath. It doesn't have to be If someone has a specific breath technique that they like to work with, that's fine. But it's really just about getting smooth, even depth. Put your hand on your belly if needed. That's the first step. Can I establish the breath? And then I do like to, step two, have a little container or something that I can visualize putting in any of the forcefulness or demand or negative fixation. Anything that's not of service, we can just set over here.
Mhm, mhm, mhm.
Again, we're not abolishing that. We're not suddenly magically going to be free from that for the rest of our lives. But just is it possible to just take a little bit of a break from it?
Mhm.
I like to then step three, set an intention, and that could be peacefulness, it could be self compassion, it could be gentleness, it could even be curiosity. That's a little bit of a bigger ask.
Mhm.
If people really want to go for it, can I be curious about this? Can
Mhm.
I notice it? And visualizations can be helpful here too. So I was using waves crashing. I also use water coming down a window, or we're
Mhm.
just watching it,
Yeah.
just watching clouds passing. We're not trying to intervene or do anything about it, right? So that intention is really important here, because I think what happens for folks is they'll see a demo somewhere and they go, oh my gosh, this is the answer. I have to do this. And then the pressure starts to rise.
Mhm. Mhm.
And
Mhm.
that's where we start seeing clients coming in and going, I'm doing it wrong. It's supposed to look like this. I didn't have that experience. So I must have done something wrong, right? That self blame starts to show up.
Right. Because what have you said? Like, there's no gold medal for somatic tracking. Is that accurate?
Yes. And it's not, and I also say it's, in terms of the breath, we're not trying to engage in the yoga Olympics here. We're literally just allowing ourselves to slow down.
Mhm. Mhm.
So then once we've got the intention set, then we can start bringing awareness to the area that is feeling discomfort, that's having a sensation. I then like to titrate away to a different part of the body to take a little break from that. So it doesn't become, I'm staring this down and I'm demanding that something happens to it. Take
Mhm.
a break from it. I used feet. You could use hands. If feet and hands are not optional, you can do rub a circle on the belly,
Mhm.
just creating any different sensation that's a little bit more neutral
Mhm.
before then coming back and checking back in with the original sensation.
Mhm. Mhm. That makes sense.
Mm-hmm.
Makes sense. And we'll put this into written form and accompany it when we post this on YouTube afterwards. We'll have the written form for everybody to look at too. So
Mm-hmm. Mm-hmm. That's a great idea.
what you've said and in words. Any other steps that you think are important for people as they're practicing?
So another thing that I wanted to bring up that we're not going to have time to do this today, but somatic tracking can be done with motion
Hmm.
as well. So
Hmm.
whether that's exercise, whether that's sitting and standing from a chair, that could be some folks with low back issues have a hard time with bending forward. So I might do that together with the client, or what are some of the activities that you've become avoidant of, and how can we start adding them in this slow, even way. So if I'm getting someone back on the Peloton for the first time in a year, we're going to take some time just talking, being with
Hmm. Hmm.
the
Hmm.
machine, slowing the breath down, getting on the machine, and just gentle motion. We're not working out together. We're just noticing what are the sensations that you are experiencing right now. And then if that's intense, then we come off the Peloton, we slow down. So we're going back and forth.
Hmm. Got it. Got it. Or even like tying shoes, right? Sometimes people like have a really hard time bending down to tie their shoes. And so slowly entering into that activity and doing it mindfully is a way to help people get back to some of these activities that they haven't done.
Exactly, because some of these things can become avoidant. I remember working with a client where he felt totally fine in his body when he was playing basketball, which he loved, when he was wakeboarding, which he loved, but tying his shoes was really scary.
Hmm. Hmm. Yeah. And tying shoes, it turns out, is way less dangerous than playing basketball or wakeboarding.
Right, exactly. When you're engaged with something like that, you're not putting so much focus on what am I noticing in my body right now,
Yeah.
if it's enjoyable.
Exactly, exactly. Do you have time to stick around and answer a couple questions if people have them?
Sure, sure. One of the questions, the top question that I usually get is how often am I supposed to do this?
Okay.
Right.
Yeah.
I don't really have a prescriptive answer for that.
Hmm.
So I will kind of just say, just try it out and see if you like it.
Hmm. Hmm.
If you don't like it, you don't have to use it. But if you do like it, then you can do it throughout the day in a non-obsessive way.
Hmm. Hmm. That makes sense. That makes sense. So if for those of you who are listening, if you want to raise your hand, we can bring you in orally. And I see a couple of Q&As that have already come in. So feel free to post in the Q&A or raise your hand and we can bring you in on the audio. And as people are getting their questions ready, Erica, are there any situations in which people wouldn't want to do this?
Well, if someone is in a state where they have genuine terror of a sensation, probably they should be working with a professional, ideally.
Mhm.
Right? If for some folks, if the sensation is really, really high, and then the intention starts to become, I need to do something to make this go away, that's probably not a great idea, and we would use a different intervention
Mhm.
in that
Mhm.
particular moment.
Got it.
Um, this is totally safe for people to do on their own at home.
Mhm.
If it's something that you can only do for even 30 seconds, that's fine. I'll take it. Right?
Mhm.
'Cause we want to start getting used to my body is a safe place to be.
Mhm. Yes, exactly. Right. That's what we're trying to help people understand. And so a couple of questions have come in and a comment just that as they were doing the somatic tracking with you, their back pain went from 4 out of 10 to 1 out of 10, which is great, right? That's not always the short-term goal for people, but it's a really nice side effect when it happens.
Yes, yes, I love hearing that. And that does happen often. A lot of times, what people will find is when they bring that gentle, peaceful awareness, they can start to kind of see that things are moving around.
Yeah. Let me open up your mic. Go ahead.
Hello. Hi. I wanted to know if, you know, my experience is sometimes that this feels like it's trying to make the connection between, like, bring me in touch with my body. And as a person who's been a dancer and has a lifelong kind of dialogue with how I'm feeling inside my body, it always seems to me like that's my problem, is that I'm too aware of every sensation and that I'm constantly wanting to jump out of my skin because I feel it all. So can you address that? Is it personality driven who this works with?
Well, what you're talking about is what I refer to as monitoring. Is it there? Is it gone? Is it worse? Is it better? Is it moving around? What's happening? Right? And when we're monitoring, we're sort of coming at ourselves in this obsessive kind of way that we can become aggressive towards ourselves. So that's kind of bringing it back to the intention piece. Is it possible for me to
Gotcha.
notice my body without going into a judgment or a demand? Does that make sense? Is that answering your question?
Yes, it does. It's actually very helpful. I think the judgment part is pretty critical.
Right. So mindfulness, being present to the moment on purpose without judgment. And we're not really particularly great at being mindful. I mean, if you consider everything that's going on in our world, in our society, we're very much driven towards what's the next thing, right? So practicing being mindfully present to the body without judgment, it's a big ask. It really is.
Mhm.
Thank you.
Of course.
A couple other questions, Erica. First one's about vertigo. So the problem with vertigo is being still is such a challenge, and we're asking people to be still. And so if you're working with somebody with dizziness or vertigo or those types of symptoms, do you do it any differently? Do you do the somatic tracking any differently than you would otherwise?
It depends. If someone is saying to me, I need to move, then that's fine.
Mhm.
That's fine. The stillness does not have to be, I'm sitting here straight and still. You know, we see this like Whole Foods has those yoga posters, and you see people where they're sitting cross legged and they've got their mudra with their hand. and they're just in this perfect state of stillness. And that might be too big of an ask for
Mhm.
someone.
Mhm.
That's okay.
Yeah.
When I meditate, I actually do move a little bit. I just kind of go with the flow of my body.
Mhm. And we're also, right, so much of it is about being present with the sensations, but being mindful about them, or as you said, being curious about them. So trying to create that sense of safety around the symptoms, noticing, watching, but not reacting, correct?
Yes, right. It's kind of the name of the game is, can I change the way that I'm responding to this? Because that's creating an opportunity for
Yes.
this volume to come down. That doesn't mean that the volume is going to automatically come down.
Mhm.
That's a process.
Yep. Yep, for sure. Next question. When you wake up with pain, is somatic tracking the best approach to relieve it? It seems like it's a conditioned response and tends to go away over time.
Mm-hmm. Yeah, good question. And that would kind of depend on, the individual. When you wake up, is the pain incredibly high,
Mhm.
or is it more that it's annoying and frustrating? Right? So there's a little bit of a variance there. But I would say try it. Right?
Mhm.
There's no harm in trying it. If you're waking up and that's the experience that you're having in your body, it's already there.
Mhm.
So there's no harm in, okay, this might be an opportunity for me to explore this.
Mhm. And I definitely, like, I personally have definitely tried that. If I wake up and there's some tension there or a symptom that I wasn't expecting, sometimes I'll just breathe into it and pay attention to it and see what happens.
Mm-hmm.
And I find it useful early in the morning.
Mm-hmm.
Um, are there situations in which absolutely you would not want people to do this?
I don't know. I don't know. I mean, there are times that I have done somatic tracking with clients, and the level of fear increased so much that we had to switch gears to something else.
Mhm. Mhm. Yeah. It, yeah, and I'd say that, definitely like if you read about it, there are some people who say like when the symptoms are super high, maybe it's not the best time to do it. I find that that's person dependent. Like I have some patients who that's when they do best with it. And so I don't consider that an absolute contraindication, but I think what you said, like if the fear is rising, then oftentimes it may be best to step away. And like you said, that you or others are available to walk people through it when the it generates that level of fear for people.
Hmm. Hmm. And that when it's that level of fear, it can be really useful to work with somebody else.
Yeah. Yeah.
So it's-
And so then last question before we sign off, is there a connection between this technique and the vagus nerve, and is it potentially related to stomach or IBS symptoms?
I'll let you handle that.
It, I think that, a lot of people feel like the vagus nerve is what conveys the relaxation response in our
Mhm.
body. And so when we are paying attention, when we're curious, when we're mindful, it probably does pull our vagus nerve online. And vagus nerve is responsible for rest and digest. And so there probably is a direct correlation with intestinal symptoms, IBS type symptoms, stomach pain, other abdominal symptoms. And so I don't know that we have direct evidence and research about it, but my sense is that anytime we're doing something that helps to settle our nervous system down, that somewhat by definition is activating our vagus nerve and helping us to mediate.
Yeah. And then just one thing about GI issues is, right, so we're talking about flight, flight or freeze versus rest and digest.
Mhm.
Rest and digest is where we want to be most of the time. When
Mhm.
we're in fight or flight, we've got 12 systems in the body, as you know, and there are certain systems that are not necessary for getting away from a grizzly bear.
Mhm.
Do not need to digest food when we're trying to get away from a grizzly bear. It is completely irrelevant to that experience that we're having. So when we're in a prolonged fight or flight state, the gut is one of the places that we see most often.
For sure. For sure. Absolutely. Anything else? Anything else you want people to know before we sign off today?
Nothing specifically, but if you keep me talking, I'll keep talking.
If people were interested in working with you one-on-one on this, what's the best way for them to get in touch?
I would say just call Cormendi.
Okay.
Call Cormendi Health. We have a phenomenal administrative staff, and we are very collaborative. We all communicate with one another, and I tend to get back to people very quickly.
Good, thank you. And yes, for anybody who's listening who's interested in talking with me or talking with Erica, get in touch with us through cormendihealth.com. There's a contact us button that will go to our staff, as Erica says, who is outstanding about knowing what to do from there. So thank you so much for being here and spending the time with us and demonstrating this for us. I very much appreciate it. We will post this on YouTube later on with some of the written instructions as well. To those of you who were listening, spent your lunchtime with us. Thank you for being here. I'm always inspired by everybody who is so open to new ideas, new techniques, and ways to look at pain and symptoms in this mind-body way. So I hope everybody has a good rest of your afternoon. I hope for everybody the weather is getting warmer where you are this spring. Erica, thank you so much. It was delightful to be here with you, and I hope everybody has a great rest of their day.
Oh, thanks so much, John. I hope it was helpful. It was really fun. It's great to be here.
Absolutely. All right. Bye, everybody.
Bye.